off the top, what did the study find then?
Yeah, thanks a lot. We have a unique data system here in BC. We can look at children's development across the entire province. We have done this for over 20 years. And since the COVID pandemic started, we have seen the steepest increase in vulnerability across the entire range of developmental areas. So this affects the social development, the emotional development, their literacy, numeracy, cognitive development, physical health, well-being. We have seen the steepest increase in vulnerability since we've been measuring.
And how do you quantify the vulnerability?
Yeah, thank you. We have teachers look at these children half year into the kindergarten school year, and then based on the measurements, we have vulnerability rates. And in the last few years, they have gone up from around 33% to now 36%. So if you think of a classroom with about 20 children on average, we have around 7 children who are struggling in at least one of these developmental areas. So that's a way of kind of quantifying it.
And I imagine it depends at what point in the pandemic these children were born. I mean, children who were born, at the very beginning of the pandemic were probably, by the time they got to, daycare or something, things were probably likely getting more back to normal versus kids who were 2 or 3 years old when the pandemic began.
Yeah, exactly. And that's what we're trying to figure out. How were the early years disrupted? BC, of course, has been quite strong in terms of their public health and education response, kept schools open, immunization was fabulous, the whole system kicked in. But social lives were disrupted. So everything from family stressors, income, sleep, healthy nutrition, outdoor play. And for the children who are at this very early stage of life where their brains develop very, very quickly, they're reliant on having these good activities on a regular basis. So if they're becoming less frequent or lacking at all, then we see that the effects are detrimental to their brain development, and we see it across the social, emotional, cognitive ranges.
And so do we know specifically why this is happening? I mean, is it just the lack of those activities, the lack of stimulation, or is it something else? Is it the isolation? Is it...
It's hard to pinpoint. Of course, children need a whole range of experiences, and we're still sifting through all the data. The shifts that we have been seeing we have seen an increase in social emotional vulnerabilities, which are good predictors of mental health problems down the road for a longer time. That happened before COVID. It's just been accelerated since COVID. And so we see that screen time has gone up considerably. Sleep is an issue. And food security has become more and more severe. And the wealth gap has been increasing. So there seem to be multiple stressors that are affecting families with young children. And they all seem to jointly be related to these negative outcomes.
And we also know that kids, even young children, are spending more and more time on screens while all of this was happening. I mean, if you were in primary grades in school, even those kids, and some of them were attending school by on screen or at least other activities. What impact did that have? Do we know?
Yeah, we know 2 things. One, just spending an extreme amount of time at that early developmental stage in front of screens is negative for brain development, the way the input works. Also, it's an opportunity cost. The more time you spend in front of a screen, the less time you work interacting with other kids, running around, have story time with caregivers. So it's both a direct negative effect of the screen time. It's also fewer good things happening to the children, and that combination, especially during the first few years of life, are not good.
Well, right. The Canadian Pediatric Association says that its guidelines on screen time say that children under 2 years old should avoid exposure to screens in between 2 and 5. It should be limited to an hour or less per day. I guess we found that was definitely not happening during the pandemic.
No, it's been increasing, but we've seen that go up before. And we see for all the experiences that are important for children, we see a strong income gradient. So families with access to resources, access to outdoor play spaces, they have an easier time to find activities for children that are positive for them. And then when you are under stress, paying for housing bills, for rent, for food, it's an easy babysitter opportunity, to put the little children in front of screens. So we're seeing a constellation that's very, very strongly related to access to resource income. We see that, for example, lone parent families, 50%, close to 50% are struggling with poverty. And all of the poverty is directly related to not just screen time, but also every other aspect of daily experiences that we know is positive or negative for children's development.
With nutrition, positive stimulation, reading, that sort of thing.
Exactly.
And what do we anticipate will be the impact of this further down the road? I mean, everybody wants to, from a very early age, try to prepare their child for success later in life. Where does this leave those kids?
Yeah, thank you. We've followed these children and can link to their for earlier cohorts. We can link these data to high school graduation, mental health outcomes down the road through education and health records, and we see that children who are struggling on one or two or three domains, and you couple this with poverty, they're more likely to not graduate on time or not graduate from high school at all. We see higher rates of mental health problems, including depression, anxiety, hyperactivity, inattention. So we see negative outcomes not just during kindergarten, but also throughout middle school, all the way into youth and young adulthood.
You're speaking a lot about income disparity today. Has this only exacerbated what we already see as the results when you look at income disparity?
Yeah, it's hard to tease out the factors specifically. It's concerning that the one group that's benefited financially in the last few years, since COVID especially, are the ones who already have $1 billion or multiple hundreds of millions of dollars. And all those additional resources that society is creating, they're now not available for public health system, for education, for childcare. So the government is working hard to build a childcare system. But if those additionally created resources are not flowing into those systems, it's very difficult to build a strong system, which Canada has traditionally been doing, but is struggling more and more.
And that would be the younger kids in the childcare system. What about in primary grades?
All these years are fundamentally important, and also the transition. We've seen that teachers and the public health system, they've been struggling more since COVID, dealing with the stressors in society, because they're now trying to support children. If you have, instead of 5 children, you now have 7 children who are showing up with vulnerabilities or with multiple vulnerabilities. We've seen an increase in lack of toilet training. So we get phone calls from Vancouver Coastal Health. We work quite closely with the communities. They're dealing with these vulnerabilities in the classroom, supporting families with services. So those systems are struggling. They need resources in terms of staff, in terms of other support structures to do the work.
Martin, it's really good to hear you this morning. Thank you so much for coming in.
Thanks so much for having me. Thank you.
Thank you.